Good afternoon, students. All are well now. Study well and prepare the notes. Today I will be dealing with the new topic, that is breastfeeding. Breastfeeding is the feeding the infant or neonate. Breastfeeding is the normal way of providing young infants with the nutrients they need for healthy growth and development. Breastfeeding is the normal way of providing young infants with the nutrients in order to get the nutrients for the healthy growth and development. That is the breastfeeding, providing young infants the nutrients. Next we will see the definition of breastfeeding. Breastfeeding is the feeding of a neonate or infant with breast milk directly from female human breast via lactation, not from a baby bottle or other container. Definition of breastfeeding. Breastfeeding is the feeding of a neonate or infant with breast milk directly from female human breast via lactation, not from a baby bottle or other container. Then, how long to be breastfed? The newborns can nurse for 5 to 10 minutes per breast every 2 to 3 hours. Newborn can give 5 to 10 minutes per breast every 2 to 3 hours. This comes to about 10 to 12 feedings per day. This 5 to 10 minutes comes to 10 to 12 feedings per day. In the beginning, there is only colostrum. Colostrum is the first milk. And there is not very much of it. This colostrum is not very much. So be ready to feed often but for short duration. So give breastfeeding very frequently. 1 month or more, as baby gets older, his stomach will get larger. He will nurse less frequently but for a longer duration at each feeding session. During neonatal period, give breast milk frequently. One reason is the first milk is colostrum. Then firstly the baby will get little amount. Then 1 month or more, a baby gets older, his stomach will get larger. He will nurse less frequently but longer duration at each feeding session. For example, he may nurse 20 to 40 minutes per breast every 3 to 4 hours. Give breastfeeding 20 to 40 minutes every 3 to 4 hours. By 6 months, baby may breastfeed for 20 to 40 minutes per breast. Per breast means each breast 3 to 5 times per day. 6 months, 3 to 5 times per day, each time 20 to 40 minutes. Then, types and composition of human milk. First one is colostrum or early milk. Is produced in the late stage of pregnancy till 4 days after delivery and is rich in antibodies. Colostrum or early milk is produced in the late stage of pregnancy, which is from birth to 4 days and is rich in this colostrum contain rich in antibodies. Second type is transitional milk. Produced from 4 to 10 days is lower in protein in comparison to colostrum. This milk is coming 4 to 10 days. In this milk, transitional milk, the protein is less compared to colostrum. Then mature milk is produced from approximately 10 days after delivery until the termination of breastfeeding. This is the types of breast milk. Then what are the benefits of breastfeeding to infants? What are the benefits of breastfeeding to infants? Helps in gastrointestinal development and function. Breastfeeding helps in gastrointestinal development and function. Helps in development of the immune system. The newborn immune system is developing through breastfeeding. Helps in cognitive development of the infant. Cognitive means thinking. Cognitive development of the infant, breastfeeding is necessary. Infants who are breastfed have reduced risk of infection compared to formula fed infant. Breastfeeding children have reduced risk of infection. Breastfed infants have reduced risk of obesity later in life. Breastfed infants have reduced risk of obesity in life compared to formula fed infants. Then reduced risk of sudden infant death syndrome. What is sudden infant death syndrome? Sudden infant death syndrome is an unexplained death. Children is died during, this is happen mostly in sleeping hours. It is unexplained death which occur in when the child is sleeping. Then Hodgkin lymphoma, leukemia and type 1 diabetics. Breastfed babies, all this condition, there is lesser risk. Then low risk of infection, example otitis media, lower respiratory tract infection, diarrheal diseases, allergies, eczema, meningitis and inflammatory bowel diseases. These are the benefits of the breastfeeding to the infant. Then benefits of the breastfeeding to mothers. What are the benefits of breastfeeding to mothers? Enhance early maternal infant bond. Breastfeeding will enhance the infant maternal bond. Maternal infant bond. Bond means relation. Aids involution of uterus. Aids means to help in involution of uterus. Involution means the uterus become normal state. That is involution of uterus. Then long-term breastfeeding helps in loss of excess weight acquired during pregnancy. If mother is giving a breastfeeding, the excess weight acquired during the pregnancy will reduce. Then documented long-term effective breastfeeding include reduced risk of breast, ovarian and endometrial cancers. Breastfeeding mothers reduce risk of breast, ovarian and endometrial cancers. Then what are the socio-economic benefits of the breastfeeding? Income savings. Reduced risk of infections and diseases, hence reduced hospital visits. There are also income saving and attendant medical cost. Mothers are more economically productive since they will spend less time caring for a sick children. Mothers are more economically productive because they will spend less time caring for a sick children. These are the socio-economic benefits of the breastfeeding.